Hi, my name's CRickard. Today I'm presenting my brochure for the Advanced Mental Health Nursing Practice subject for the Master of Nursing. My target audience in presenting this brochure is undergraduate registered nurses for a careers expo. There's a great need for case managers in continuing care teams across not just the state but also Australia. My aim is to enlighten the undergraduate fraternity that there is more to nursing than hospitals, general practitioner clinics and schools, which in my own experience were pretty much the only options that was given to us. Throughout the presentation, I'll be identifying the role, the scope, the requirements, the communities, the services, the treatment and management options, the team, the tools, where to learn more, and key resources, as well as key points on why. The role. Provision of continuing care for people with severe and persistent mental health issues through a team approach with service coordination and working directly with people to support them in achieving their recovery goals, engage in their community, achieve well-being, and live a full and meaningful life. It's all part of being a case manager. Case managers are the hub of the network of supports to assist people in their recovery goals. The scope. Working within your scope of practice. Through your stream as a registered psychiatric nurse, nurse practitioner, or clinical nurse consultant, you will provide education through supported decision making, assist with assessment, planning, implementation and evaluation of services, systems, treatment therapy for your clients, family and or carers. The requirements. Whilst the CCT multidisciplinary team of social workers, occupational therapists and psychologists, the registered nurses require a psychiatric endorsement from the Australian Health Practitioner Regulatory Agency, or AHPRA, preferably a Master in Mental Health or equivalent. Services also usually ask for a minimum of 2 years' experience in the mental health discipline. The communities. Victoria state-funded mental health services, metropolitan and rural, are divided into 3 communities for breast provision of age-related and age-appropriate skills, experience and services. Services vary, but generally, child and adolescent services range from 0 to 18 years, adult 18 to 64 years, and aged person 65 years plus. In recent years, there has also been a big jump in specialty services for adolescent and young people aged 16 to 25, such as Headspace. The services. You'll be collaborating with both public and private sectors, GPs, specialists, legal, housing, education and employment services, community organisations, volunteer services, NDIS, Centrelink, allied health, and the list goes on. When people's basic needs are met, they have more energy and focus on relationships, both for themselves and others, and optimise recovery. Treatment and management. People with complex health needs need complex treatment and management. Using your nursing knowledge not only to care for your people in the context of their lived experience, but to educate them and arm them with the tools that they need to maximise their freedom and independence. After all, it is not just about clinical care, it's about connection. Community is where real and lasting connection provides the pillars of well-being. The Dream Team. CCT is generally a full-time position, Monday to Friday, approximately 8:30 a.m. to 5 p.m. Whilst working mostly autonomously in and out of the office, meeting people in their homes or via telehealth, you'll have the skills and support from a multidisciplinary team to draw on compromising of, but not limited to, social workers, occupational therapists, and psychologists, with your powers combined. The tools. Regardless of where you come from in mental health, these tools will be your first aid kit in case management. Build a therapeutic alliance. That is the foundation. Provide trauma-informed care. Regardless of their condition, these people have probably been through a lot, and there's a lot of anxiety that comes with healthcare service provision. Ask what you can do for them. Don't assume. Listen and validate their experience. The situation or diagnosis is one thing, but we need to look after them, understand their experience, so we can better provide for their needs. Once their needs are met, it's a lot easier to manage your mental health conditions. Service and organisation coordination. It's hard enough to deal with your own mental health issues, let alone navigating the landscape of the mental health system currently as it stands. There are so many community service organisations, and people don't know how to get access to them. Having them wait for a long time to get looked after by one service that just refers them to another is a common complaint. Understand what their needs are so you can best guide them to where they can get help and support. Assess their mental state and ability to safety plan, contain risk, and reach out when they need to. It's not a straight road to recovery. If you want to learn more about case management, consult with your local service. Talk to your education team. Discuss with your clinical supervisor. Speak with peer support workers who have an understanding. Learn from people with a lived experience. Look at online CPD. Consult institutions that provide endorsed postgraduate education. Resources. Arm yourself with the best tools that you have that are evidence-based, recovery-orientated, and person-centered. In a strengths-based model, we need to help people to become independent of their illness. They know it's often not going to be cured, but they know that it can be managed, and through self-management comes self-value and self-confidence. Using resources for clinicians like Mental Health Pod is an excellent start, but also having a black book for your consumers so they can call people when they need to, as they need to, so they can become self-sufficient and independent and build a life where they can regulate their mood, their behaviours, and their condition. Key points on why. There's more to nursing than wards. You can work autonomously with the support of a highly skilled team. Use your skills and experience in a lasting way through the recovery-orientated framework. Build networks and communities through coordination of care services. Focus on recovery and rehabilitation rather than ratios. Be team-based, not task-based. Have regular hours and weekends so you can manage your own mental health. Develop your interpersonal and interdisciplinary communication skills. Be part of the bigger picture.